core group, thank you so much for taking time out of your day to join us today. Couple housekeeping items. At the moment, all of you are on mute. At the end, we will open up for questions and unmute all of the lines. If you have a question in the middle, that you go ahead and just use the raise your hand function, and I will try to monitor those and type you a response, or we will get to it at the end for certain, but we'll make sure that any questions you have do get addressed. We are at the top of the hour, so I think we will start. I'd like to introduce Bill Richardson, who is the Director of Sales for Allianz, who is a tremendous resource to us and to you, and we thank you, Bill, for taking the time out of your day to present this great idea to our advisors. Hopefully you will all, come away with better knowledge and something that you can roll out to your clients. So with that, Bill, I will turn it over to you.
Perfect. Thanks so much. Well, good afternoon, everybody. My name again is Bill Richardson with Allianz Life here. Have been at Allianz for the better part of 7 years, but before that was a financial advisor with FSC Securities for a number of years as well. And so certainly speaking to clients, speaking to the needs of clients and financial advisors is near and dear to my heart. And as we look at the changing landscape of our business, it has never been more important, in my opinion, to be providing holistic financial planning, to be looking at the whole picture for clients as we talk about their futures, talk about their retirements, and we look at ways that we can help them be successful as they not only get to but through retirement. And our topic today, talking about healthcare costs, is, I think, one of the most relevant and important topics that we can possibly cover. I'll share with you just a couple statistics that hopefully will sell you on the fact that this is worth taking a half an hour of your time, which, by the way, for those of you who are expecting an hour, we should be done probably half an hour to 40 minutes at the most. But here's the thing, healthcare costs, when we talk about this as a topic, is it relevant, is it important? Well, here's what we're finding. Number one, it is, according to most research, and we do have a statistic that we'll show in a minute, it is the number one concern for affluent pre-retirees. And so when we talk about what is going to be a big concern for our best clients, our best prospects, this is their number one concern. It's healthcare costs spiraling out of control, and you can see that on the screen there. That's 72% of affluent pre-retirees articulates that's the case. So what's the opportunity? Well, Fidelity did a study about 2 years ago, and they asked a number of questions to financial advisors like yourselves. They asked them to rank themselves in terms of their knowledge of accumulating assets, of income, distribution, and for the most part, most of those financial professionals surveyed said that they had a fair amount of confidence. 70% roughly on most of those questions indicated that they felt confident in their ability to help their clients with those topics. However, when Fidelity asked that same group of financial advisors, how comfortable are you talking about healthcare costs in retirement with your clients? Only 7% of financial professionals indicated that they were comfortable having that conversation. So talk about a tremendous opportunity. You have one of the biggest concerns of pre-retirees, of affluence, which makes sense because they've got their arms around most of their expenses, but here lies kind of the snake in the grass. They don't really know what they're up against. They don't know what these costs are going to look like, and so they're scared. You have the number one concern of your best clients and prospects that only 7% of your competition are talking about. And so in a post-DOL world, again, as we talk about how to provide holistic planning, how to be looking at the client's best interest, this is certainly a topic that is relevant, that's important, and is a differentiator really for a lot of the financial advisors that are using this as a means to reach those clients across the country. As a matter of fact, and I want to show, just even before we start the formal presentation, I just came across about a week and a half ago a very interesting article. Let me see if I can grab that for you quickly here. And it was on healthcare costs, and it was an update to the study that we had been looking at from earlier in the survey that I'm going to show you here. And if you look here, this is from Yahoo Finance from September 18th. They're looking at how much does it cost a 65-year-old retired couple to cover their health care costs. And the number that they're throwing on the board there, $260,000, is up 6% from what they published in this exact same study about a year ago when they said it would be about $245,000. And while I really like Fidelity's research here, they do a nice job of explaining, by the way, this doesn't include a lot of things like long-term care, incident, and insurance. What they are neglecting to mention here is the factor of inflation. And what we are seeing is they're anticipating, and their number is right around 6% in the last year, very similar to ours that we were showing on the other screen, which was about 5.8%, which is what we are anticipating that inflation rate on those healthcare costs to be on a move-forward basis. And that's a significant dollar amount. And so the point of what we're going to do today is really look at what are these healthcare costs? What are the real costs that are associated for these retirees? The idea here is not that any of you would necessarily be getting into the business of selling med sups or that kind of business, although many of you may, but that is really not the point of this. The point is to educate and inform our clients and our prospects on what this huge looming cost is going to be and to provide them a solution that's going to allow them to fund for what is going to be a long retirement full of a lot of healthcare costs. So let's kind of look at the state of things as they are today. First of all, as you can see here, overall inflation since 1999 has actually been about 43%. And that's good news when we factor in that workers' earnings have gone up about 54%. So we're okay. We're actually outpacing inflation slightly with our earnings. But that's misrepresentation if that's the whole story that we're looking at, because health insurance premiums, look at that, have gone up over that same time period 191%. And again, based on the numbers we're seeing, that is not a trend that we anticipate will change. So what we're going to do, again, as I mentioned, we're going to first of all demonstrate how healthcare coverage works in retirement. And for some of you, that's going to be review. For some of you, it's going to be brand new. Number two, we're going to show the potential costs and impacts of healthcare coverage. So what does that mean? What does it cost? And what is that impact going to look like on retirees? And then third, of course, develop a strategy to help cover those potential out-of-pocket costs. And one thing I should note as well is, before I go any further, this PowerPoint that I'm sharing with you is a client-approved PowerPoint that you have available to use with your clients if you should so choose to do a workshop or an educational session with them. The other thing that I've seen a lot of people use this, there's a couple slides on here that are very telling just by themselves and are great conversation starters used individually. So either whether it's a one-on-one session with a potential client or existing client, or if it's a seminar setting, whatever the case may be, this is available to you, and your good friends at CORE can have access to this and can get this out to you after we're done. Okay, let's look at the different pieces to Medicare. So first of all, Part A is going to be what's your hospital insurance. And as you're looking at what Part A does, what it covers, this is going to be basically anytime your clients head into an emergency room, head into a hospital. And what we're going to see is that while there is no deductible there's no out-of-pocket expense in the form of a premium, there could be a significant out-of-pocket expense associated with this those hospital occurrences should a client be hospitalized. Part B is going to be your traditional medical insurance, what you think about as your traditional doctor's visits, heading over to see your checkups. That's going to be a Part B is going to have with it some insurance associated with that. You're going to be able to have some. There's going to be a copay. There's also going to be some premium associated with that we're going to take a look at in a minute. But that's your Part B, again, your medical, traditional, what we think of as a traditional medical insurance. Your Medicare Advantage plan, your Part C, is going to be a combination of A, B, and D, and that may be a choice that some clients are going to take as it combines all those together, but some may choose not to do that and may choose to go with a different plan. Part D is going to be your drug coverage, the easiest one to remember, Part D, drug coverage, and that one's going to vary significantly based on your client's health. The good news for you as a financial professional and for your clients is that they have the opportunity once a year to review that plan and make changes if it's appropriate for them. And then finally, Medigap insurance or Medicare supplement insurance is going to be available for most clients. That's going to fill in the gaps. It's really going to be intended to cover all those different parts of A, B, and D that don't that aren't covered by A, B, and D, and help your clients also cover premiums, out-of-pocket expenses, and deductibles. So again, just a high-level overview on the different parts of Medicare and the premiums. So here's the actual premiums for Part B and Part D. And now this is for 2015. And what we're going to see here is already we're going to see why affluent pre-retirees and retirees should be concerned about this. What you're looking at when you look at Part B premium is it's going to be based on your modified adjusted gross income. So that the amount that you're paying can, as you see here, as much as triple based on what your modified adjusted gross income was 2 years prior. So there's a 2-year look back on that. As you can see here, for individuals or married couples, the lowest bracket is $104.90. That's a monthly premium that, by the way, for those of you that don't know, comes straight out of Social Security for most people, B and D premiums. You can see all the way up to individuals or married finally jointly at $428,000 or more are looking at a pretty substantial premium hike of $335 per month, and your Part D premium going all the way up to $70 per month. Now that was based on, that was your 2015, and that's going to be what we're going to look at next, is what the changes or the increases are moving forward, because that's, I think, a very telling story. So now when we look at the hold harmless rule, as I mentioned before we go on to look at some of the changes, the hold harmless rule, what it really is meant to do is to say this: if we do have, in fact, an increase in those premiums, an increase in the Part B and D premiums, but we don't have a cost of living adjustment on our Social Security, the intention here is we don't want the average American to see a reduction in their Social Security payment. So what the hold harmless rule was meant to do is to say, okay, if that's the case, then your Social Security payment will stay level for that next year and hopefully get a cost of, well, we did just have that happen. That very situation happened for this year. And what happened at the end of last year when Obama did go ahead and pass the budget, we also saw him extend that hold harmless rule to all of the different MAGI classes. What that rule was intended to do was really to protect your lower modified adjusted gross income couples, and he went ahead and extended that to all of the brackets so that there would not be a decrease in Social Security payment. Now let me pause here and throw a little bit of my own color or interpretation. I think we're all aware of the Social Security Trust Fund that is a large part of what is funding Medicare. I think we forget about that a lot, that Social Security is more than just the Social Security retirement benefits. It actually also is a part of Medicare. That is a looming problem that we're all aware of, and so those kinds of adjustments where we don't see, or we see, excuse me, the hold harmless rule extended, or even have it at all, I think we are going to be a thing of the past. And I think most people would agree that it's far less likely to be the case moving forward, as we've got to do something to cover this incredible gap that we've got between our Social Security Trust Fund and the funds that are coming in to cover the benefits being paid out. Okay, but now here is the projected income brackets for 2018. So again, there's a 2-year look back. So this is your clients that this year, their modified adjusted gross income is going to be, they're going to take a look at this year's income for 2018 premium. And what you're going to see if you go down to the bottom there is that the top brackets significantly are reduced, meaning in order to get up to that top bracket where you're paying 3 times as much, you're going for a married couple making $428,000 to $320,000, and even that second to the bottom bracket, we're going from that bracket being $320,000 to $428,000 to being just $267,000 to get there. So again, it justifies, I think, a lot of the fear that a lot of those affluent pre-retirees and retirees have, that we are, in a sense, picking on those folks in terms of picking up a lot of the burden for the additional income needed to the Social Security Fund to pay for the benefits. So let's talk briefly about Medigap policies. One thing to note here is, and we'll see this in a little bit later in the presentation, that they vary significantly. And as a trusted financial professional, this may be one area where you do get involved. You may choose to do that because there can be a significant savings in different policies just by shopping them around. They are commodities in the sense that it's truly a price structure, but they're not commodities in the sense that different programs are going to look at different rating factors, and they vary significantly. Some will have a lot to do with income levels, some will have to do with gender. socioeconomics, all kinds of factors go into what changes these Medigap policy premiums and terms. But it certainly is something to look at with your clients as they look to cover the gap here, as you can see there, of co-payments that aren't covered in that Medicare policies, co-insurance, and also deductibles. Okay, so we've talked a little bit generally about what all these different pieces are, and taking kind of a timeout from the presentation for a moment, as I'm speaking to a group of financial professionals that may use this presentation. As you can already see, the idea here isn't to get into all of the intricate details of the different policy types. Really what we're trying to get to as a financial advisor, you want to know, well, what's the brass tacks of how much it's going to cost? Now, you can choose to obviously go into more detail with each of those different parts and outline for your clients what they look like. But what we're finding is most of the financial advisors, especially if you're fairly new in having these conversations, like to keep it fairly high level and get to the part that really impacts you as it pertains to your clients, which is the cost. So let's take a look at that. And strategically, in terms of, again, taking a time out from the presentation, what you're going to see here is we're going to throw these numbers out at this point, and then we're going to break them down. And the reason I like that is it gives the clients a minute to pull themselves together after they see these big numbers and help us to kind of explain where we're getting those numbers. And if anything, by the end of the next few slides, I think most clients will agree we may have actually underestimated the amount that it's going to take to fund this, not over. So here's the brass tacks. It looks like today, what we're looking at today is a healthy 65-year-old couple, and we're again assuming a life expectancy of 87 for male, 89 for female. We're looking at a healthy 65-year-old couple needing to have $394, almost $400,000 over the course of their retirement in order to pay for their health care costs. If we're looking at a 55-year-old couple that's looking to retire in 10 years, we're based on inflation. Again, that's a key component that we are factoring into our numbers that, like say Fidelity, and they will be first ones to tell you, yeah, we're not factoring inflation in. We have estimates, but we're just putting today's dollar amount on it. So our estimate is that the health care for a 55-year-old couple is going to be $463,000. Again, we know those are big numbers, so let's break down where those came from so that you can see where we're coming up with those different estimates. First of all, Medigap premiums, we're looking at an average of $183 a month, and that's based on the national average from 2010. Clearly, in the last 6 years, those premiums have not gone down. If anything, again, I would say that we are below probably where they are today, and it varies significantly state by state. And as you can see here on the right-hand side, variations due to a lot of different factors: rating practices, plan types, state insurance markets, types of pricing, demographic differences. You know, it just really feels like as you look through the different lists of the different ways that these companies price, that there's a significant difference, and there's a lot of factors that go into that. So it certainly is worth shopping around. Okay, well, let's take a look. So this is really, I think, if you're going to take a screenshot, or if you're going to, now again, not literally, we have this all available to you, but if you're going to take a snapshot of one screen that I think might tell the story, if you want to boil it all down to one screen, I think this is really the one. So as we mentioned earlier, Part A premiums, no premiums with Part A, but what I can also tell you is this: there is a $1,200 deductible before you hit insurance for Part A. And here's what that means. If your clients walk into a hospital, they have no coverage for the first $1,200. And I think for those of you that have spent any time in an ER, I have 3 little kids, and I can't say that I haven't, you can get to $1,200 in about that fast as soon as you walk in that door. And you also need to know that it's by occurrence. This is not an annual deductible. It's by occurrence. So every time, every unique time you step foot in that hospital, you're going to be on the hook for whatever it costs, up to $1,200. But for our purposes, we're factoring on 0 cost. When we look at Medicare Part B, we looked at the lowest bracket. So we're using $104.90 per month. It's a $1,200 yearly cost. Medicare Part D, we're looking again at that same lowest bracket in terms of premium. But what we're going to do for Part D is we're going to factor in, this is important to note, $1,900 was the average for Medicare recipients in terms of their actual costs back in 2013. And then again, that can vary significantly, but that was the average cost. And then finally, with the Medigap plan, we're looking at a $2,100 a year cost. And what I can tell you is this: if you jump onto the Medicare.gov website, which I'll show you that in just a moment, and you type in your zip code, 90% of the plans that you will see will be far more expensive. As a matter of fact, most of them are in that $4,000 to $5,000 per year range. So again, the idea here being, we want clients, when they see these numbers, to, if anything, go, holy cow, this might actually be even shortening or shorting what we need, rather than them arguing with you on, well, no, we won't need that much. So when you look at that number, and you obviously put that times 2 for a couple, you've got about an $11,500 in today's dollars. That's your need that you have to cover to cover those premiums for Medicare and some out-of-pocket expenses, but not all of them. So again, cost of living adjustments and inflation. Over the last 30 years, we've seen about a 2.8% average increase in our Social Security payments. I think if we were to poll most of our clients, I would guess 90% of them would say that number, if we give them the option, is that going up, down, or staying the same, is probably going down. We saw 3 zeros in the last 12 years. That's going to be a trend I think that we continue to see. And then, of course, Medicare Part B premiums, the average annual increase over the last 30 years, 7.1%. We can all feel it. That number is probably going up, if anything. All this to say that we are not even yet talking about long-term care costs. And those can obviously be incredibly significant. Those can be game changers in terms of a family's financial situation. When we looked at the 2015 average for nursing home costs in the United States, $91,000 was right around the increase, or excuse me, right around the cost, with an average of about a 4% increase per year over the last 5 years. Those costs, again, I don't think are going to be significantly different in terms of inflation rates. So we are certainly going to be seeing a lot of costs there. And as, again, the population continues to age and healthcare advances make that more and more an important discussion to have with your clients. A lot of you may talk about or position long-term care insurance with your clients. This is a great opportunity to do that on in a separate vein, I guess, than the other costs, because we're pulling that or intentionally holding that separate from these costs. Clearly, there's a number of ways that you can fund that, and that's, again, another conversation for you to have with the client. Medicare.gov is actually, don't laugh too hard, this is a government website that does work, and it's actually pretty helpful. It's pretty user-friendly. If you jump on the website, and I certainly would be one of my calls to action after our calls, to jump on that website, click on the supplements and other insurance. You can see there, find a Medigap policy, and it will ask you to put in your zip code, and as I mentioned, it will pull up for you a whole list of different Medigap policies ranging in different coverage types and qualification, and you can get a better idea, I think, once you do that, of what the average costs are going to be for your clients in your area, as those can be fairly different depending on the area of the state that you're in. There's also a handbook that you can provide to your clients, Medicare and you, that is a good summary of what their different options are. So, okay, let's get to a strategy here. So we've looked through the numbers. We know that $11,500 in today's dollars is about what we're looking to fund. We know that if we're looking at a 65-year-old couple today, $394. If we got a 10-year window, right around $463,000. So how can we cover that? When we ask, or when I show this particular presentation, I've done this across the country with different client groups. I mean, I've heard multiple times from people in the audience, Bill, I don't even have that much saved in my 401k total, let alone just set aside for healthcare costs. And I think it's a real eye-opener. And so what's important about this discussion is I want to show you now, from an Allianz perspective, how you can cover a $463,000 healthcare liability with just a fraction of the assets. So what I'm going to pull up for you at this point is an illustration of one of our products called the Allianz 222. And the reason I want to show you this product, there's going to be some very specific reasons why I like this product, why I think it is definitely a unique solution when we're trying to solve for this equation. But let me just show you, this is actually a page out of our illustration. And what you're seeing here is a 55-year-old couple and we put in just $165,000. So again, remembering that 55-year-old couple, we estimate going to need close to $470,000, and we're putting in just $165,000 for this couple at age 55. You can see here we wait for 10 years before we turn on any kind of an income stream. And at the point we turn on income, you can see over here on the far right-hand column, we're providing a $14,000 income that first year. So when we think about that 10 years of deferral, we also have to remember there's, on average, 5.8% inflation on those costs. So that gets us pretty close to $14,000, payment one. But what's so unique, what is absolutely unique about the Allianz story, and it's the reason why you're able to put less assets in up front, is that's not where the story ends. As a matter of fact, your first paycheck is your worst paycheck, because our unique increasing income story allows your clients the opportunity to put less assets in and still be able to fund that increasing income need for their healthcare costs as they go on through retirement. And so as you can see here, that first payment, $14,000, and that payment just continues to go up. We get out to age 75, they're already at a $22,000 payment, you can see here. So we've already had a $7,000, a 50% increase in that payment over that time period. As the years go on, what's also significant to note here, when we get out to age 80, you can see that the account value has actually gone to zero. But because of the way that our increasing income story works, they continue to get pay raises. As a matter of fact, in that year, in the next couple of years, they see an almost $5,000, and as a matter of fact, from the time that they run out of income, excuse me, not income, run out of assets in their contract, from the time they run out until the end of the illustration, they're seeing a $10,000, almost $10,000 increase to $35,000 as their payment each year. And not insignificant to note, the grand total of income paid out for that couple from 65 to 85, so we're still not even to age 87, which is what we looked at in terms of life expectancy in our prior PowerPoint. You get up to that point, you've given your client $468, to almost exactly the amount that we talked about we anticipate needing, and you've gotten to do that with just $165,000 put in at age 55. So I think this is a really compelling story to be able to share with your clients, to be able to explain to them why we would use a fixed income alternative, is what I call these things, an FIA, to fund that guaranteed income need. And this is really a critical piece as we look at a lot of these different Fidelity studies. Obviously, they're an expert when it comes to a lot of these different topics, and even Fidelity in their PowerPoints. Now, Fidelity, who does not really sell annuities, does not manufacture, I should say, any annuities, they will admit that annuities, pensions, and Social Security are what we should be using to fund healthcare costs, because it's an essential income need. And it's not going down, it's going up. And so this is, I think, a truly unique story. So I also want to show you, and again, I'm not going to get really too much into product details, but I do want to explain how this particular feature works so that you understand why this works, why it's unique, and how we're able to do this for your clients. And so what I'm going to do is I just want to show you how that increasing income opportunity works within our products. And this is all of Allianz's preferred products have this story. And as a matter of fact, the 222 I'm going to show you actually has an enhancement on this story. The first thing that we need to do is understand annual reset and increasing income. And very quickly, annual reset is still one of the best features on an FIA, because what it does is allows your clients to take advantage of that annual reset by looking at this year's ending value as next year's starting value. We don't have to make up any losses. There's no risk to your principal in an FIA, and on top of that, the crediting strategies that we use start new every single year. There's no multi-year point-to-points in an Allianz product. They're all annual reset products. And once you understand that, I think this next definition will make even more sense. And this is just how simple the story is with our FIAs increasing income. As a former financial advisor, I can tell you one of the things that frustrated me to no end was the complexity to annuity products. And once you understand this increasing income story, your temptation is going to be to throw, now I'm sitting here in Minnesota, we call them yeah buts. Yeah, but what about this? Yeah, but what about this? There really aren't any. It's very simple. It's straightforward. It's easy to explain to a client. And it's all it is last year's payment times this year's interest. So it's last year's payment times whatever interest credit the clients get from their indexes equals next year's payment. It's not tied to a contract value. It's tied to the indexing. So let's take a look at an example quickly, just again to make sure that you understand that, and then I'm going to open it up for questions right after this. So if we have a $500,000 starting income value and we have a $20,000 initial payment, again just looking at a random example, that $20,000 we know is going to be, again, a couple key phrases a lot of our top producers. Your first payment's your worst payment. It can never go down, only can go up. If we have a 15% correction even, that payment will not go down. And that's not unlikely. We actually saw that from June until about February of this year, June last year to February, we saw about that. We're coming to the end of a 7-year bull run, one of the longest in history. Certainly corrections on its way. And with any other annuity product, all the way back to 1983, any annuity product ever sold, we have a statistic on this, that's seen a negative return in the first year and has taken out a withdrawal, and when you factor in fees, although there are no fees associated with our 222, has never seen a pay raise. And so we know that that is basically the kiss of death for any kind of increase. We know that $20,000 payment is guaranteed, and that's a good thing, but it won't ever go up. But the unique story of the Allianz Increasing Income is that if a 2% index credit happens next year, just 2%. Again, your contract value has not gone up 2% because you're taking a withdrawal out of there that's probably greater than that. But an index credit of 2% means your clients get a 2% pay raise. So you are, in essence, giving your clients an increasing income on a depreciating asset. Now, I have done this presentation probably hundreds of times at this point, and I have asked this question. I've never heard a good answer to it. Where else can you sustainably provide your clients an increasing income on a depreciating asset? And again, that becomes your new floor. That payment can never go down. It can only go up. So if you have a down year the next year, you keep the same payment, annual reset kicks in, the following year you get a 3% index credit, you get a 3% pay raise. As a matter of fact, you can give your clients an increasing income on a depleted asset because it's tied to the index, not the account value. So even after that account value goes to zero, your clients continue to get pay raises. So the reason I wanted to define that for you is I think that's an important piece to understand how it is that we did it. How do we do that? How do we provide that max amount of income with the least amount of assets? How do we solve for a $470,000 health care need with just a little over $150,000? That's how we do it. So with that, I will just throw that last slide up here. This is a great question we ask our advisors, and they talk to their clients. So we want to protect our clients' retirement income from taking a hit, meaning we want to protect them from having healthcare inflation and taxes erode slowly over time their purchasing power. And again, what we're trying to do here is not just insure a payment, but insure a lifestyle. And so that's what we do at Allianz with our product features, and that's why I think, again, this healthcare conversation is so incredibly relevant and so timely. So with that, I'm going to turn it back over and just see if there are any questions. So I'll turn it back over to Cora.
Great. Thank you so much, Phil. That is great information. Everyone, I'm going to unmute your lines now. If you have a question, please go ahead and speak out.
Okay, please do. I hope they do. Okay.
Anyone? All right, well, barring any questions, again, Bill, thank you for your time. For all you advisors out there, if you would like more information or you would like to discuss specific opportunities, please reach out to your core relationship manager. If you don't have one or don't know who that is, you can call the main office at 800-991-6695. Again, 800-991-6695. And you can ask for Alan Bradley, who is our annuity specialist, or any other member of the case design team, and we will be more than happy to help you out and discuss this in general or discuss specific client opportunities that you might want to talk through. Again, Bill, thank you very much for your time. We appreciate your help. And with that, I will end the call. Everybody have a great day. Thank you.